I call the Rules Committee to order. Today we are holding yet another hearing and another event in the Rules Committee, examining the hunger epidemic in America today. With Memorial Day just 4 days away, the committee will hear from experts on how hunger and food insecurity impacts military families and veterans. Let me say that again. Across America today, there are spouses and children of service members who may not know where their next meal is coming from. And for too many women and men who serve our nation and are now back in the civilian community, they and their families are struggling to put food on the table. We have to call the issue what it is. It's a national outrage. Too often. Okay, hold on. Okay, all right. Do I got to start again?
Yeah.
Okay, I have to start again. I'm sorry, everybody, but I didn't listen to the instructions. All right. Anyway, okay. I call the committee to order, and I welcome everybody here. Thank you so much for being here today. You know, the Rules Committee is focusing on this issue of hunger and food insecurity in America. And today, we are holding an event to focus in on the issue of hunger amongst our veterans and amongst our military families. And with Memorial Day just 4 days away, the committee will hear from experts on how hunger and food insecurity impact military families and veterans. Now, let me say that again. Across America today, there are spouses and children of service members who may not know where their next meal is going to come from. And for too many women and men who serve our nation and are now back in the civilian community, they and their families are struggling to put food on the table. And we have to call the issue what it is. It's a national outrage. Too often, hunger is hidden among these communities. Service members are taught to make good with what they have. Numbers are hard to come by because those who have served often don't want to risk their futures by coming forward or struggle to ask for help. But here is what we do know. Before the coronavirus pandemic hit, more than 35 million people were going hungry in America. That includes 10 million children. Of that total, it is estimated that over 3 million are veterans and their families. Women veterans are hardest hit. Nearly 28% of all women veterans suffer with hunger. 28%. For military families, high spousal unemployment rates and limited access to affordable childcare make finances even tighter. Something is badly broken here. Those who serve our nation put their lives on the line for us. The least we can do, the very least, is ensure that they and their families have enough to eat. And as we head into Memorial Day, I want to do more than just talk about respecting our veterans. I want to act. That's why we're here today, to shine a bright light on this topic and hear what is being done on the ground and what we need to do if we are trying to move forward to come up with a comprehensive plan to end hunger nationally. Now, I had a good conversation with VA Secretary Dennis McDonough about this issue. I think he cares deeply about the issues we're going to talk about here today. I conveyed how important it is that the administration make veterans' hunger a top priority, and hopefully a major part of an eventual White House conference on hunger, nutrition, and health will focus in on this issue and on how we can solve it. You know, as my colleagues know, I'm working to build support inside and outside the Congress, and as well within this administration, to have a White House conference to develop a roadmap to end hunger in America, not to manage it, not to simply say that it exists and acknowledge that we have a problem, but finally bring it to an end. And the United Nations has set a goal to end hunger globally by 2030. I think it's time that the United States have a plan here at home to make sure we meet that goal. That includes ending hunger among military families and veterans. And before we hear from our witnesses, just a little on process. In just a moment, I'm going to introduce our witnesses. They will each speak for about 3 to 5 minutes, giving us an overview of their written materials. Then members will be asked if they have any questions, and we urge them to kind of keep their questions within a 5 to 7 minute kind of interval. We don't really have any time limits here in the Rules Committee, so no one's going to listen to anything I say. So I'm just but I think for the record, we want to see where we can get it, make sure everybody gets an opportunity to be heard. And and at this point, before I introduce our witnesses, I want to recognize Mr. Rushenthaler for any opening comments he may have, and then we'll go right to our witnesses.
Thank you, Chairman. I truly appreciate it. I appreciate all the panelists for being here. I'm going to keep my remarks brief because I want to hear from the witnesses. I'm a veteran. I've been an advocate against hunger even when I was in the state Senate, Pennsylvania State Senate. So, with that, Mr. Chairman, thank you for yielding. I yield back, and I'm looking forward to the testimony.
Thank you very much. Now let me introduce our witnesses. Kathy Roth Duque is the CEO of Blue Star Families, the largest chapter-based nonprofit organization serving active duty of all branches, Guard and Reserve, wounded and transitioning veterans and their families. Ms. Roth Duque is a practicing attorney, a member of the Small Business Association Advisory Board, and is co-chair of the Bipartisan Policy Center Defense Reform Task Force. She's a military spouse of 18 years, 4 deployments, and 9 moves. Abby J. Liebman is the president and CEO of Mazone, a Jewish response to hunger. Prior to this, Ms. Liebman had a consulting practice to assist social justice organizations, businesses, and public institutions meet the challenges of the growth and change. For over 20 years, she has worked with and led some of California's most prominent nonprofit organizations, including the California Women's Law Center, which she co-founded and directed for 12 years. She served as chair of the West Hollywood Human Services Commission and a member of the Los Angeles Mayor's Advisory Committee on Child Care. And I should also say that Mazone has been on this issue for as long as I can remember, and we appreciate their advocacy. Dr. Colleen Hefflin is a professor of public administration and international affairs at the Maxwell School at Syracuse University. Her research is aimed at understanding the processes that create systems and patterns of social stratification. Dr. Hefflin's recent projects have focused on the National School Lunch Program, the Special Supplemental Nutrition Program for Women, Infants, and Children, and the Child and Adult Care Food Program, and their effects to a household's overall food insecurity. She has also focused on veterans' well-being and social program participation compares to that of other groups. Chad Morrison is Chief Executive Officer of the Mountaineer Food Bank. Mr. Morrison began working there in 2008 and helped launch the mobile food pantry program in West Virginia. The program hosted 33 food distributions that fed over 8,000 families in the first 3 months. From 2014 to 2015, he worked at the West Virginia Department of Education before returning to the Mountaineer Food Bank. Mark Walker is the Deputy Director for East Bay Programs at Swords to Plowshares. A veteran himself, serving 6 years in the United States Air Force, Mr. Walker has extensive experience implementing and managing systems and programs for veterans. Prior to his current role, Mr. Walker served as Deputy Director of the American Legion's National Employment and Education Division in DC. I think I got everybody, right? Okay. I thank you all for being here. And Ms. Roth Duque, we will begin with you. So welcome.
Thank you so much, Chairman McGovern, Ranking Member Cole, and distinguished members of the House Committee on Rules. Thank you so much for the opportunity to testify before you today. I need to mention, I think that's an old bio. I'm happy to say I'm married 23 years now.
Congratulations.
Thank you. So my name is Kathy Roth Duque. I'm the CEO and co-founder of Blue Star Families, as you mentioned, the largest national nonprofit organization supporting military and veteran families. Through innovative programs and partnerships at the national and chapter level, Blue Star Families helps military and veteran families thrive. We are nationally recognized for our annual Military Family Lifestyle Survey. It's the largest and most comprehensive survey of its kind. It covers a wide variety of topics, including food insecurity, that affect military and veteran families. Today, I'm here to share with you what our survey, this one and others, have revealed to us about food insecurity. So in 2020, we saw that 14% of enlisted active duty family respondents, 14%, and 12% of veteran family respondents reported low or very low food insecurity. It's true that a greater proportion of junior enlisted family respondents were food insecure, but the issue was not limited to the junior enlisted ranks. We saw it 16% in mid-grade ranks and 8 to 9% even in senior enlisted. Our data shows that military families of color in particular are struggling with food insecurity at higher levels than their white peers. So we think this warrants more research. It's worth emphasizing that in the military community in particular, food insecurity is an issue that primarily affects families rather than single unattached service members. It's not an issue of military pay for an individual. It's about a family's security. The military lifestyle is currently structured in such a way that for many families, it will inevitably lead to financial stress. We know from our research and from our lives that several intersecting structural challenges embedded in the military lifestyle contribute to military families' financial stress. And those are military spouse unemployment, the lack of affordable childcare, and high out-of-pocket housing expenses. And I'd like to say a few words about each. Because of the frequent relocation, limited childcare, and the high service member day-to-day job demands, military spouses face really significant barriers to employment that are unlike their civilian counterparts. The unemployment rate for military spouses was nearly 7 times greater than the national unemployment rate pre-pandemic. It has not really changed since we've been measuring it in 2012. At the same time, 70% of millennial military family respondents say that having 2 incomes is vital to their family's well-being. That tracks with national data showing that middle class and working class families largely need 2 incomes to meet their goals. So the military lifestyle contributes to military families' financial insecurity by inhibiting a spouse's ability to work. The pandemic certainly made that worse. 42% of the spouses who had been working lost their jobs during the pandemic. So limited childcare affordability and to some extent availability contributes to financial concern for military families. The active duty respondents who were financially stressed and had a need for childcare, out-of-pocket childcare expenses were the most commonly reported contributor to their financial stress. So crucially, this lack of affordable childcare is a major contributor to military spouse unemployment. It's really the #1 reason. 34% of our spouses who are unemployed but needed or wanted to work cited this high cost of childcare as a barrier for their work. Military family financial distress is further compounded by high out-of-pocket housing expenses. Today, the basic allowance for housing for military members is pegged to 95% of local area rent, but that doesn't take into account the cost of a quality school district. We see in our data that families are prioritizing their children's school, often paying significantly more out of pocket than DoD's cost share estimates. We call this the impossible choice between financial security and getting a quality education for people's children. So each of these factors, the high out-of-pocket housing expense, the lack of affordable childcare, and the high military spouse unemployment undermine a military family's financial readiness, contribute to food insecurity. And unfortunately, this financial stress does not end when the family leaves the military. To the contrary, the family's financial difficulties can be compounded by transition-related challenges and thereby could be a factor leading to veteran food insecurity. So we believe that creating the conditions for active duty family financial resilience will help prevent veteran hunger downstream. Together, we must work to address the underlying factors that contribute to food insecurity among active duty families. However, these issues are persistent and they will take time to resolve. So in the interim, members of this committee can take immediate steps to address food insecurity in military families by supporting the Military Hunger Prevention Act of 2021, which would create a basic needs allowance to provide a temporary financial assistance to low-income military families. This bill should be seen as a stopgap measure until the root causes of military family financial stress can be addressed. It's a problem that's solvable, but it takes structural change. I'd like to again thank the distinguished members of this subcommittee for their efforts to eliminate military and veteran hunger. Those who make significant sacrifices to our country should never struggle to put food on the table for their families.
Thank you very, very much. Ms. Liebman, welcome.
Thank you. Almost forgot to unmute. Chairman McGovern and distinguished members of the House Committee on Rules, thank you for the opportunity to testify before you today. I also want to acknowledge that it's a privilege to follow Ms. Duque because Blue Star Families has been a remarkable partner to us in the work that we have been doing regarding currently serving military families and food insecurity, as well as veterans. My name is Abby Liebman. I'm the president and CEO of Mazon, a Jewish response to hunger. Mazon is a national Jewish organization working to end hunger among people of all faiths and backgrounds in the United States and Israel. Mazon's work includes identifying emerging and persistent hunger needs, then seeks to explore, understand, and develop solutions to these problems. For almost 10 years, food insecurity among currently serving military families and among veterans have been top priorities for our work. Today, I'm going to focus my remarks on our experience regarding military families, but my written testimony explores food insecurity for both currently serving and veterans, and I'm happy to answer questions on both. This is also not the first time that Mazon has weighed in with Congress nor the executive branch on this topic. We embarked on this work in 2012 when a colleague at a food bank approached me and asked if there was anything that could be done to exclude the military's basic allowance for housing as income for purposes of determining eligibility for SNAP. Well, at first blush, I naively thought that this would be a straightforward fix of an oversight in the law. And here we are almost 10 years later, and despite numerous requests by us and other advocates to make this change, neither USDA nor this Congress has done so. To this day, I find this as frustrating as it is perplexing. But rather than giving up, here we are again, and we are going to persist in this effort, and we will try again with the new administration to get USDA to address this oversight. Our efforts around the BAH led us to learn more, and the more we learned, the more we knew that like many issues of hunger, this one is complicated. So we also explored numerous strategies with USDA, the DoD, and Congress in response to military hunger. In 2018, we proposed creating a military family's basic needs allowance as a comprehensive response to the complexities we saw. While this too has not yet been adopted, we remain hopeful that in this Congress, the Military Hunger Prevention Act will become law. Over the past 9 years, we have seen greater awareness of military hunger, more colleagues willing to work towards solutions, and a recognition by policymakers that they can make a difference here. However, the problem not only persists, but it is actually worsened. We all know that COVID-19 exposed the gaping holes in our country's nutrition safety net, and we are facing a true hunger crisis. Millions of Americans are facing food insecurity for the first time in their lives, including those who currently serve our country and those who have served. Military families face unique challenges related to spousal unemployment, frequent relocation, and persistent stigma and shame that exists around acknowledging that they are food insecure, as well as applying for help through programs like SNAP. Well, we know that there is a food pantry on or near every single military base in the United States. Securing additional concrete data about the scope of military hunger has been a challenge, and the Blue Star Family Survey is an essential part of what we know, but it cannot be as comprehensive as that which our government could do. However, in just the past month, the Journal of Nutrition released a study that was led by USDA researchers about military families struggling with food insecurity and the tragic impact this has on mental health and Army retention rates. They found that 1/3 of the households responding had experienced food insecurity. 1/3. Clearly, we know this is a persistent and serious problem, particularly for low-ranking and junior enlisted service members, but not exclusively. In April, Mazon released a report entitled Hungry in the Military, Food Insecurity Among Military Families in the United States. Through our collaborations with other advocates, we've identified a number of recommendations for change that will provide real and meaningful relief. These are not complex, they are not extreme, they are sensible, straightforward, and well within the power of Congress to implement. First, support the Bipartisan Military Hunger Prevention Act. Second, encourage USDA to ensure that a service member's BAH does not count as income in determining eligibility for federal nutrition safety net programs. If USDA determines yet again that it doesn't think it has the authority to do this, then Congress should re-examine military pay levels, ensure that work requirements for SNAP recipients are not used to prevent veterans from receiving SNAP when they cannot find full employment, connect more veterans to SNAP, call on the GAO to provide comprehensive and updated data about food insecurity among veterans and military families, encourage federal agencies, including DoD, USDA, and the VA, to actually collaborate and share information, data, resources, and strategies. And finally, support Chairman McGovern's call for a White House conference on food, nutrition, and hunger. Allowing hunger among veterans and military families to persist is shameful, and it should be alarming to Congress, to this committee, to the White House, the Pentagon, and the VA. We must do better to ensure that no one who makes great personal sacrifices in service to our nation struggles with hunger. Thank you, and I look forward to your questions.
Thank you very much. Dr. Hefflin.
Chairman McGovern, Ranking Member Cole, and distinguished members of the Rules Committee, thank you for the opportunity to speak with you today. My name is Colleen Hefflin. I'm a professor at the Maxwell School at Syracuse University. My research focuses on social welfare policy, food insecurity, and other measures of economic well-being. Today, I'm honored to speak with you about the problems military and veteran families confront in meeting their basic food needs. My written comments focus on 3 issues. Number 1, food insecurity is a significant problem among military families today. Number 2, the transition from military service to civilian life is a period that is often associated with difficulty meeting essential needs. And 3, disabled military veterans face an especially high risk of food insecurity. You've just heard 2 compelling statements about the issues facing our military families. I just want to underline that food insecurity represents a problem for force readiness and is linked to issues of spousal unemployment and the treatment of the housing allowance in the SNAP determination process. And I hope that we have the opportunity to talk about data needs around food insecurity for our military families in our discussion later. I want to focus for a minute on the transition from military to civilian life. So we know now that food insecure service members are more likely to leave at the end of their service period and not re-enlist. But unfortunately, the separation period is often a point of increased hardship, such as food insecurity, especially for those separating at younger ages and with fewer job skills that easily transition to civilian jobs. SNAP participation among veterans is about 10% higher during the first year after leaving military service than it is for the general veteran population. However, given the need to overcome the social stigma associated with receiving SNAP, as well as potentially prior negative experiences with the program, I support the creation of an automatic transitional SNAP benefit for all families leaving military service below some salary cutoff in the E4 to E6 range. Turning to our veterans now, a USDA report released yesterday indicates that 11.1% of veteran households were food insecure in the 2015 to 2019 period. And that food insecurity among veterans is higher among female veterans, minority veterans, and disabled veterans. While military service members are selected for their good health, veterans are more likely to be disabled than civilians, and this is especially true of younger veterans. This is important because having a disability is a significant risk factor for being food insecure or having other forms of material hardship, such as housing hardship, utility hardship, or even medical hardship. In fact, US households with an adult who's unable to work because of a disability face levels of food insecurity that are 3 times that of the general population. While veteran status confers many advantages after separation from the military, being a disabled veteran removes this protective effect with respect to food insecurity. Why is disability so highly correlated with food insecurity? First, incomes are lower because of reduced work activity of the disabled member and their caretakers. Second, physical limitations in the ability to buy food, transport it home, prepare it, and eat it without assistance may pose a barrier to food access. Third, cognitive limitations, such as those associated with a traumatic brain injury, may make it harder to do the financial planning that's required to stretch limited resources each month. And finally, hearing loss. may be associated with reduced social interactions and network support that increase the risk of food insecurity. Many people assume that we take care of our disabled veterans, and we should. However, due to a number of factors, including stigma and lack of information, few working-age disabled veterans participate in both veteran and civilian disability programs, even though many likely qualify for both. This lack of participation is likely one of the underlying causes for food insecurity among disabled veterans. USDA can't solve this problem on its own. Improved coordination of services between the Veterans Affairs Disability Compensation Program, the Social Security Administration's Disability Insurance Program, and SNAP is needed to improve access to these programs, raise household income for disabled members, and reduce food insecurity. In closing, food insecurity is a significant problem among our military and veterans today because of a failure of several different federal agencies to work together and consider how our policies interact and are experienced by families across America. We owe these families who sacrifice so much a comprehensive safety net that protects them from experiencing food insecurity throughout their lifetimes. Thank you for the opportunity to speak with you today. I look forward to your questions and the discussion ahead.
Thank you very much. Mr. Morrison.
Good morning, Mr. Chairman and distinguished members of the committee. Thank you for the opportunity to address the committee on the topic of veteran hunger. My name is Chad Morrison, and I am the Chief Executive Officer at Mountaineer Food Bank, headquartered in Central West Virginia. I have been involved in the hunger relief community for almost 13 years, from doing boots on the ground work, managing food distributions and disaster relief efforts, to the policy and administrative side of the work. Within these roles, I've had the opportunity to connect, engage, and even break bread with hundreds, if not thousands, of individuals struggling with hunger. I'm grateful to see that the issue of food insecurity, especially for one of our most vulnerable populations, veterans, has been elevated for this discussion. Today, I'm going to speak to some of the nonprofit government collaborations that we've been able to accomplish here at Mountaineer Food Bank. My organization has been working directly on programming that addresses veteran hunger since 2016. That year, Feeding America, a nationwide network of 200 food banks, reached out to us with a call to action for this population. A cohort of 7 food banks was asked to participate in a pilot partnership with local VA medical centers to design a food pantry model to provide to veterans being served by the VAMC. It was made very clear beforehand that there was no dedicated funding for this project and that the food banks would be responsible for developing and funding this opportunity. After our initial discussions with the Martinsburg VA Medical Center, it was quickly determined that a minimum of 50 veterans could immediately benefit from this program. Food banks always operate on a shoestring budget, and in 2016, our budget was razor thin. But this call was different, and we felt that it was our responsibility to find a way forward. Mountaineer Food Bank was the first food bank of the cohort to actually hold a food distribution as part of this pilot, having a mobile style distribution in the parking lot of the Martinsburg Medical Center. You've probably seen these mobile style. They've been put in the media the past year with the COVID-19 response, as bringing a refrigerated truck to a parking lot and distributing directly to families. The first distribution, we served 50 veterans, and then the program quickly grew, and we expanded our partnerships to include the Beckley and Clarksburg VA medical centers. The program was branded as the Veterans Table, and we developed agreements and procedures for how to work with the sites and for how to work with the social work departments at each of the medical centers. Over the past 5 years, the VA Medical Center partners have been essential in doing this work and reaching our most vulnerable veterans. They have developed driver teams and home delivery routes to reach veterans that are homebound, that lack transportation, or just feel uncomfortable or not able to be in that crowded setting. Because of these efforts, we have been able to double the veterans served to over 1,000 veterans each month. With that said, there are still tremendous gaps and barriers for us to overcome. With the Beckley VA alone, we could easily expand the services by an additional 1,000 veterans each month. The Beckley VA serves 13,000 veterans every year, and they estimate that 10% of those veterans fall below the poverty line and could benefit from these food services. Each food box costs between $25 and $30 each, and the delivery component by the VA is essential to reaching veterans that cannot travel or live in rural communities. Veterans often face tremendous barriers, especially in rural America, including the lack of public transportation, equitable food access, access to broadband and employment, as well as many physical and mental health difficulties that they are up against every day. We know that there are veterans living in substandard situations who would not ask for help and will be even wary of accepting services from someone that they did not know. We know that many of our veterans struggle with chronic disease and ailments, and in many cases, struggle with PTSD. Many of the vets that pick up food boxes or receive food boxes actually have animals with them, whether it be a service dog or not, but it is amazing to see the amount of animals that come through in the vehicles at our mobile distributions. And that's where these opportunities are so special. With proper attention, collaboration, and appropriate resources, these gaps can be filled. Through collaborations between nonprofit and the government sector, we can meet many of the needs of our most proud and vulnerable populations, our veterans. I'm happy to answer any further questions, and thank you for my time today.
Thank you so much. Mr. Walker.
Greetings, Chairman McGovern and distinguished members of the Rules Committee. My name is Mark Walker. I'm a 6-year United States Air Force veteran and Deputy Director of SOARS the Plowshares East Bay office. Founded in 1974 by veterans, SOARS is a veteran service organization that provides needs assessment and case management, employment and training, housing and legal assistance to veterans in the San Francisco Bay Area. War causes wounds and suffering that last beyond the battlefield. SOAR's mission is to heal the wounds of war, to restore dignity, hope, and self-sufficiency to all veterans in need, and to prevent and end homelessness and poverty among veterans. Our model of care is based upon the philosophy that the obstacles veterans face, such as homelessness, unemployment, and disability, are interrelated and require an integrated network of support within the community and continuum of care. Today's topic of food insecurity is critical. In 2020, COVID-19 made it more difficult for homeless veterans to access food, due in part to the lack of community resources and services, as providers faced increased expenses and decreased funding. Even veterans housed in permanent supportive housing sites, many of whom are aging and disabled, find it difficult to find adequate food due to the shutdowns and health risks posed by the virus. SOARS work relentlessly to address food insecurity faced by the veterans under our care. We strengthen our partnerships with local nonprofits to deliver nutritious meals to our veteran clients. To their credit, the VA loosened program restrictions during the crisis, giving us new ways to engage with homeless veterans by providing longer-term emergency housing and food services. For many months of the pandemic, we purchased and delivered weekly groceries to veterans scattered in temporary hotel stays across the Bay Area. We also received many generous donations from corporate and community partners, big and small, that provided prepackaged meals throughout the pandemic. When veterans cannot afford daily meals, it feels worse because of the contract they made with America. Serving this country without condition, it's a real gut punch and very demoralizing when veterans are in need, but resources are lacking. As an organization focusing on assisting at-risk and homeless veterans, we see up close the need for adequate meals to sustain veterans' physical and mental health. Not being able to consistently eat can lead to hopelessness and negative behavior. Veterans are a prideful group. Consequently, it's very difficult for them to ask for help. So when they do and don't get the type of care required, it can instantly lead to mistrust and isolation. While battling food insecurity among our clients, SOARS focuses on stabilizing veterans through housing. Once safe housing is settled, veterans can work on other aspects of need. Without stable housing, the journey back to self-sufficiency is almost impossible. Due to our determined work with homeless veterans and their families, SOARS understands homeless veterans need a sustained, coordinated effort that provides secure housing and nutritious meals, essential physical health care, substance abuse aftercare and mental health counseling, as well as personal development and empowerment to include job assessment, training, and placement assistance. Thank you for the opportunity to share SOARS perspective on hunger and hopelessness among veterans.
Thank you very much. And I want to thank all of you. This is very compelling testimony on a topic that is incredibly important, but a topic that doesn't always get elevated to the front pages of our newspapers, and quite frankly, it's not talked enough about here in Congress. But in any event, as chair, I usually go first and ask a gazillion questions. Everybody else has to listen. But I'm gonna go last in terms of the questioning, and I'm gonna happily now yield to Mr. Rushenthaler if he has any comments or questions. And
really appreciate it. And I just want to thank everybody for testifying. Mr. Walker, you were dead on when you were talking about the fact that this does go to military readiness, not only the dignity issue. These service members volunteer to serve, and it's the least we can do to make sure they're not food insecure. But I cannot recall if it was Kathy or Abby was talking about the BAH issue. Do you mind Mrs. Lieberman, that was you. Liebman, that was you. Do you mind just rehashing that briefly for me?
Not a problem at all. The issues with the BAH are that under the rules for how the USDA determines income and your eligibility for SNAP, there are a list of revenue streams that are not counted as income. And BAH is not listed among them. It is therefore the position of USDA that it is in fact income. What happens here is if you live on base, your in-kind housing is not counted as income. If you're a civilian and you get a voucher to live in public housing, that is not counted as income because those are in the list. So we really thought this was a glitch and an oversight in the law. I still really believe it. Not quite sure why it seems so hard to correct. We believe USDA actually does have the legal authority to do this through an executive regulation, but they have not. So the other avenue here would be for Congress to address this either through the Farm Bill or some standalone legislation. Does that help?
And Mr.
It helps. Oh, I'm sorry.
Yeah, I wonder if I could
yes.
too. Thank you. And in addition to that, which we completely agree with, and we appreciate Mazzone's leadership on it, Blue Star Families also feels that BAH is inappropriately calculated in the first place for military families because we end up with what we call the impossible choice. We're being asked to create financial security for our families living within the means. At the same time, we want to have good, safe school districts for our children. Well, BAH is not calculated based on places that have 50% or higher rated schools and safe areas of living. So families are routinely spending far more out of pocket than is anticipated because of the need to move the children into safe neighborhoods with good school districts.
No, thanks so much. I definitely agree with that. You know, when I was in the service, I was incredibly fortunate that I was single, no dependents whatsoever. But I definitely understand the BAH factor and the choice. When you were describing that choice in your testimony, even though I didn't personally experience it, I totally got what you were saying because I saw it in those I worked with and in my legal clients as well. Well, I just appreciate. Is there any other? Let me see how I can. Besides a sweeping pay increase for enlisted. And by the way, I think next time we look at pay increases, I think it should just focus on the enlisted ranks. I think there's a big difference between giving an admiral or general pay increase what tagged to what an E1 makes. I think we should look at just the enlisted ranks next time we do a pay increase to bring them up more. But besides something that's sweeping change, is there any just small technical change like the BAH issue that would have an immediate impact beyond the BAH and the BAH income that would have an immediate impact?
I think the Military Family Basic Needs Allowance, which is part of the Military Hunger Prevention Act, is one of those kinds of changes, Congressman. It is about providing an allowance specifically for those who are struggling, but it does so using a process and an approach that removes some of the stigma and shame that existed in a similar program that existed years ago. It is a way of helping to provide this kind of support as a supplement in the moment, because I would say, frankly, in my years on this work, the idea of a sweeping increase in military pay is probably not in the near future. So thinking of this as this moment that you could act and do this, I think it would raise up what the sort of just the basic spending that those military families have at their disposal, and would make a real difference. So I would say that is one of the critical first step here. I mean, and I know that there's a lot of need for data. The DoD received instructions in the last NDAA to explore greater data on this issue. I understand that they have contracted that out and that the report's due, but not till December. And in the meantime, you still have these families struggling every single day to feed their children. And that is wrong. So yes, this is something you could do right away. And I know that Congressman Panetta would welcome the support of that particular bill as it moves through the Congress.
Thanks, I appreciate it. Mr. Walker, I know you didn't. Would you like to add anything before I yield back?
No, I would just say, look, if the systems aren't working, then folks come into my drop-in center. So we want to make sure that there's work across regions and sectors and silos to advance coordination around this issue, so it doesn't get to the slippery slope, but it ended up at my drop-in center.
If I may add a revenue neutral solution that actually would probably bring money back to the Treasury, if we could slow down the rate of PCSs or allow for some predictability and control over service members' careers, where there's lots of evidence this would increase financial security, and it would save us from paying those high move costs. So I think that's worth looking at.
It would also help with retention. Right. If you slow down the whole nother topic, but I'm going to yield back just so you know, Chairman McGovern, I don't want to put you on the spot, but my staff is already reaching out to your staff on the BAH issue, kind of get to do a legislative fix. So if you are looking for a Republican to help, don't want to put you on the spot, but I'd love to partner with you. And with that, I yield back, Mr. Chair.
Well, I look forward to working with you, and I appreciate your being here and your questions. Let me at this point ask you. I'm going to ask unanimous consent to insert in the record a letter from my friend and our colleague Congressman Jimmy Panetta of California, who's a leader in the fight to end hunger among military families, and he authored, as has been mentioned, the bipartisan legislation, the Military Hunger Prevention Act, to establish a basic needs allowance to help alleviate hunger among active duty military families. And I support the legislation very strongly, but I look forward to continue to work with him. He sent us a really powerful letter. I wanted to include as part of this record. At this point, I want to yield to my colleague from Pennsylvania, Ms. Scanlon.
Thank you, Chairman, and I really appreciate your hosting our roundtable again. And thank you to our witnesses for joining us in this discussion about hunger, food insecurity among military families and vets. I come to this from several different perspectives. My sister's a vet, as was my father and many other relatives, so I've seen some of the challenges our veterans face close to home through family members. I grew up and have family who live near Fort Drum in northern New York, which of course is an economically depressed region, and my sister was a school teacher in a district there that served hundreds of military families stationed at Fort Drum. So I've both seen and heard of some of the struggles of our military families. And then I've represented veterans in a variety of efforts to get access to services over the past several decades, first as a pro bono lawyer, someone who is organizing folks who work with legal aid, and now representing my constituents as they seek benefits. So these are obviously individuals who've served our country, but often struggle to get the support they need or even to identify what that support is. In my district, we have almost 30,000 veterans from all age groups, all walks of life, and many have service-related disabilities, including PTSD and having obstacles like unstable housing, lack of employment. So we have some great partners in this work, the National Veterans Legal Services Program. Also locally, we've got a homeless advocacy project that has a veterans project that does work to get people access to SOAR benefits. And we also have a Veterans Multi-Service Center. So some resources, but clearly not enough. There's more we can do. So I really appreciate your insights. Ms. Hefflin, you probably are most familiar with Fort Drum. It's only about an hour north of where you're sitting. Can you speak more to the bureaucratic hurdles that prevent service members from enrolling in SNAP while they're in the military, and how that can affect how they I think we've got you.
Yeah, I think you might want to repeat that because, technology is great, but it's not that great. So just the end of that question.
Okay, so my question was, if you can talk us through.
Okay. Well, that's all right. Yeah, I think she's going to maybe try coming back on. We'll give her a second here. And
Do you want me to start speaking to
why don't you?
Administrator Burns?
Yeah, that'd be great. You get the first part of it. We just lost the second part of it. Okay.
Yeah, sure. So I think we've already heard a lot about special issues. Is that?
Yeah, why don't you proceed, and then she can ask the second part when
Okay.
she gets back.
All right, so we've heard about special issues military families face about the eligibility, but SNAP as a national program faces a high level of administrative burden anyway. And so this is a program that requires people to submit a lot of paperwork, demonstrate their financial need, who lives in the household, their household expenses. They go through a full redetermination every year on average. If they're disabled or older, it could be every 24 months. But this is a program that regularly, 1/4 in many states of people experience periods of administrative churn. They just fall off the program, even though they remain eligible, because they were not able to finish all of the application procedures in time. And so there's a high administrative burden to SNAP anyway. One thing that could be really useful is to create a categorical eligibility between either people with service-connected disability at a high disability rating or among the DI program. And so we, as a country, haven't we've been moving the other way and thinking about categorical eligibilities, but I think we know that disabled individuals are going to have trouble, cognitively dealing with the issues associated with the administrative burden. Perhaps if they need help, that means they're going to have to get on the phone or go down to an office, and there's transportation issues. And so I think thinking about categorical eligibility for SNAP among our different disability programs would be could be very helpful and powerful in this regard.
That makes a ton of sense to me. Having had a relative who dealt with PTSD as a result of military service, the number of challenges they were facing, just to even work through the system was really, really tough, and that makes a lot of sense. One of the issues we see with folks in my district is trying to make sure we've got a good connection to people exiting the service. So when people leave the service, that they know what's available to them and will reach out for it, because similar to firefighters and other first responders, this is not a group that likes to ask for help. So what outreach should we be doing to let new veterans know that they might be eligible for SNAP or other services?
Well, so currently there is the Transitional Assistance Program that all separating service members participate in. However, there haven't been a lot of what I think of as rigorous evaluations that have shown positive impact of that program. It's joint between DOD, VA, and Department of Labor, and it's hard to really explain all the programs people are eligible for. And when we ask service members later on, over half of them don't even remember attending the program. So we know we have a fix. It doesn't seem to work very well. I would support having a 6-month transitional SNAP program for all exiting service members up to the E4 or E6 range, so that we could tell them, thank you for your service. Don't worry about this for some period of time. And then you can, you're already on the program. And so now you're opting about how to remain on the program. Once you've established yourself, found your new house, found your, got yourself potentially in a new living situation. But for the first 6 months, don't worry about it. We have your back. I priced this out. If we use fiscal 2019 numbers, in the average household benefit level was $258 a month, and say 100,000 separating members were eligible for 6 months, this would only cost about $154 million annually. And keep in mind, SNAP benefits total at $55 billion in fiscal year 2019. So this would be a small dollar item that could really help our service members during this critical transition period and make that just a little bit easier for them.
Mr. Chairman, can I just add one thing here? I think I'm really intrigued by the suggestion, by the way. It's the first time I've heard it. Because what we have learned is that oftentimes those working at the VA service centers who are actually engaged in helping people, that vets go to the VA for help. They don't go to USDA. They are not aware of departments of public social services. This is not a place they want to go. They think the VA is their one-stop shop, and yet it is not. We have done a couple of webinars for intake workers at VA centers all over this country because they didn't know SNAP existed. And if they did, they thought this was not a program that vets were eligible for I don't know what reasons. So it means that there's also that information gap where something like this, that it's a automatic benefit that is targeted around veterans that are transitioning or currently serving that are transitioning to veterans, would remove some of that challenge. Because, Mazone is a small but mighty nonprofit, but there is no way we can do a webinar for every single intake worker all over the country who is working with veterans. And that's where the federal government really comes in. So this would be a very important, really intrigued by this. And then also, Congresswoman, I would say that the idea of more outreach is really critical here. And it has to be informed outreach, because this is a burdensome program to apply for. It is hard. As Professor Hefflin was saying, is that there are a lot of barriers here. And it's going to take a lot to support people as they go through this, especially because there's a stigma around this for those who served in the military, both either currently serving, of course, but also for vets. And we want to be able to take that away, to just say that's a non-issue. You've earned this. This is what we're going to do for you, so you can find that stability and be on your own feet and move forward and thrive in this country.
Now, I know that at our local VA in Philadelphia, at our VA Medical Center, a year ago in January 2020, they opened an on-site food pantry to which they are now referring veterans after they're reporting or being screened for food insecurity. So we've seen the VA be a link here. Obviously, having to send someone to a food pantry is not a long-term solution, and that's definitely helpful. But we remain concerned about folks who don't regularly get services through the VA. So how can we be more robust in connecting them through services there? And it is good to see you again. I think we were introduced by your board member, David.
Yes, David Latchfield. It's nice to see you too.
Ms. Scanlon, I think Mr. Morrison wanted to respond.
Yes.
Yes, thank you. And I really just wanted to concur with what Abby and Colleen had spoke to. It seems like, and we do operate food distributions with our VAs, it seems like when the program is built for veterans and worked through those systems, that is much more, it's much more acceptable. They're much more willing to not push it off, because we do get We see this with veterans. We see this with seniors. They don't want to take away from somebody else. They absolutely want to make sure that they're in that mindset of, providing and taking care of, their country, their families. So whenever the program is built for them or directed for veterans and it's theirs, there's less of that stigma of, oh, I don't want to take from someone. But whenever it's, whenever it is, this is for veterans, this is for military families, this is ours. This is a thank you for everything that they've done. It's much more accepting, and it goes so much farther. And we found that with our food distributions because there's no stigma with that. They appreciate, and it's for them, and that's the way that we've tried to develop our programming.
Certainly tracks with what I saw as a pro bono coordinator. We had so many volunteer attorneys who were just so eager to do work for veterans as a thank you, but finding them and getting them to accept the gift was always extremely difficult. So always looking for those pathways to help make this an acceptable gift. I yield back. Thank you.
Thank you very much. I also want to insert into the record at this time a letter from the Military Family Advisory Network. And they found through a survey of military families that 1 in 8 respondents was food insecure. The letter states that the COVID-19 pandemic has only compounded those issues. And in their latest survey, 1 in 5 respondents were experiencing food insecurity. I'm recognizing people as they came online, so I'm going to Mr. Desagnier next.
Thank you, Mr. Chairman. Thank you for your leadership on this. And I wish you spoke first because you're the smartest, so I always get good ideas to ride along on. Mr. Kett, I wanted to ask you if I got the number right. You said 40% of the spouses, and I'm going to spend a little time on COVID, and it's a great crisis, but there's an opportunity here, I think, to make people more aware, but also maybe get some real solutions. So you said 40% of the spouses have lost employment. That, first of all, is that the right number? And second of all, if you look into those numbers, I'm going to assume that a lot of those jobs are not high-paying jobs. They're in the service industry or maybe in healthcare. And then the point that they're constantly moving makes it even more traumatic because they've got to go out and find a new job. So maybe you could just add to any information you have from your survey or otherwise about that cohort of people, because it suggests to me that there's an opportunity here. The Biden administration definitely wants to add early quality education and childcare to infrastructure. I think it's pretty clear that it's infrastructure under this social model. So maybe you could just help me with that, identifying who those folks are and also the challenges they're going to have coming out of COVID to try to get those jobs, but also pay the bills with those jobs.
Thank you, Congressman, for that question. I appreciate it. Yes, the number is 42% who had been working at the beginning of the pandemic lost their jobs. And we came back and surveyed them, and 2/3 of them still have not returned. Now, of the remaining, the 42% lost their jobs. What about the remaining? Well, overall, 47% of spouses reduced their hours. So virtually every working spouse, and it was the minority who were even able to work because our unemployment rate was already so high, was really hit hard by the pandemic. And you're right, they are disproportionately jobs in the hospitality industry, in other areas that are often entry level at retail that did get hit hard. This is one reason why we saw many of our military families of color, military spouses of color, have even higher unemployment rates and higher food insecurity rates. And that's because they're disproportionately in some of the younger ranks and have those kinds of jobs. So childcare in the infrastructure bill would really make a difference.
And in that group, is there higher rates of higher divorce rates than generally accepted in the general population, and higher domestic violence?
That's a great question. We don't know about divorce rates. We may have some data on domestic violence, and that I'll have to enter into the record.
That goes to comment earlier about data and where we could get more of that for researchers. Mr. Walker, thank you for the great job you do here in the Bay Area. I want to follow up a little bit on the challenges of silos and bureaucracies. Here in California, having been involved in trying to remedy our homeless issues. In California, if memory serves me, we're about 12% of the US population, but we've got almost 30% of the homeless population. And having been involved in a long time, we've got a lot of silos. We've got cities, counties, nonprofits, school districts, and then all of the departments within that. One of the things that were successful, at least in my experience, in Contra Costa County in the East Bay, was having basically a single point of contact as best we could, which of course you do such a great job with, on this group on veterans. So our homeless outreach team within the health department, we developed a medical model, we identified the problem of homelessness as a health condition. That has worked to the degree we can recruit and retain good people with good behavioral health expertise, people skills, but then the ability to coordinate these various agencies. And I know it's been tough in Representative Lee's district in Oakland, where homelessness and unfortunately the high cost of living and wage disparity, trying to get a house in the Bay Area or housing in the Bay Area or in Boston or in Washington or in Los Angeles, which are all regions that disproportionately create GDP, but working people who are on the bubble all the time. So it strikes me that one of the biggest things we could do is, at least at the county level in big counties, or at maybe lower, is to get a single point of contact who could coordinate all these services.
I agree, Congressman. I think it's important that we streamline the process and that there's a place for veterans know to go to, as well as other service providers who have federal funding, but they still speak to the whole community and so serve the whole community. So I think it is tough between county and cities, but I think what the Bay Area is trying to do now is try to align services across the region instead of just focusing on a particular city or county. I think getting to that place, I think the big thing is we know who's homeless. So there's a by name list for homeless veterans. There's a VA. So there's a central contact. And as we do that, I think that's where progress is being made. And also leveraging the state and local funding as well. Because it's, again, federal government can't do it all. So how do you leverage those local and county and city dollars? So I think in that place, we're doing a good job and trying to move further to sort of eliminate veteran homelessness.
I just add one of the things, experiences we had here, and spending a lot of time on the Transportation Committee on this issue. Generationally, police departments have one big police department in the Bay Area used to have, and still, I'm told, still has an understanding that they call apprehend and relocate, which means putting people who have behavioral health issues on transit and basically directing them in another jurisdiction. So I've been told there's a similar problem in DC, where they're put on WMATA and sent to another jurisdiction. Similarly here in the Bay Area, and we know this because the jurisdictions at the end of the line get them. So one of the things we've done in the East Bay is providing social service and health people on the transit system. But again, it's these bureaucratic fiefdoms or silos trying to get the transit agencies to realize there's an opportunity to work with other agencies. I wonder if you have a comment, because I'm told this is a problem in urban areas around the country, and it got worse during COVID.
Well, that's a little bit, I'm not sure of that particular issue. I just think that what we're trying to do here in the East Bay and all of the Bay Area is that there's no wrong door. So at any place that you come into, any service, community service provider or VA in this system, that they can be referred to the relevant benefits for them to sort of get off the street and get towards self-sufficiency. So.
Okay, thank you so much. Thank you, Mr. Chairman. I yield back.
Yeah, no,
did you want to jump in?
Yeah. Dr. Hefflin wanted to say something, and let me just say to all the witnesses, because since we do this virtually, we're not all in the same room, so not everybody can see when people's hands go up. So if you have any response, just shout it out, and I will recognize you, because I see everybody here. All right. So Dr. Hefflin.
Thank you. So I don't know about the specifics of the East Bay community, but I know in general that food insecurity takes a lot of different systems to work right in order to solve. So we need to have resources to buy the food. We also need to have food to buy. which gets at, food deserts and healthy access to food. We need to have transportation to get to the food and to get the food home. And then we need to have adequate housing and utilities in order to be able to cook and prepare the food. And so it sounds like a simple thing, but it actually requires many, many different parts of society to work without fault in order to support healthy access to food for all families.
Yeah, I appreciate that, Doctor. I do think, though, from the client's perspective, when we're client-driven, then if you get the one person contact who can shepherd them through the system, it obviously works back better. You have to have all those other things, but if the client's not comfortable, as you all know, accessing the system and going through those forms, it doesn't do much good. Thank you, Mr. Chairman. I yield back.
Yeah, thank you very much. And I think one of the things that this discussion is pointing out is that to solve this challenge, it doesn't fall neatly in one discrete area, right? I mean, we've been meeting separate and apart from the stuff we're doing here on focusing on the issue of hunger and food insecurity. We've been meeting in the Rules Committee with all the incoming secretaries, just a getting to know you meeting. And I've been bringing up at the end of all these meetings the issues we're talking about here today, plus on a wider scale. And, we talk about transportation. We had a meeting with Secretary of Transportation Buttigieg, and we talked about the role the Department of Transportation can play in helping to combat hunger in this country. And he got it. I mean, so it's not just Secretary Vilsack at USDA. It's not just Dennis McDonough at the VA. I mean, every department and every agency. And again, one of the reasons why the Rules Committee is doing these hearings is because we have jurisdictional constraints in individual committees. So, Agriculture Committee doesn't do a hearing on transportation needs, to get people to, live in food deserts, or it doesn't talk about, and vice versa. Transportation doesn't talk about SNAP. And so the Rules Committee, we have no jurisdictional boundaries. So we're in many respects kind of operating almost like a special select committee to just cut across all of that. And again, one of the reasons why we want the administration to do a White House conference is because, again, this is an all hands on deck approach. I mean, even just dealing with the issue of veterans and active duty, military families, again, they don't all fall in just one little discrete area. It's a whole bunch of stuff. And I think we need to make sure that we have a whole of government response here if we're going to be effective. I also want to insert in the record a statement from the National Military Families Association. The letter states that food pantries, as I think Ms. Liebman mentioned this earlier, that food pantries and operate on and near virtually every military installation. And many military families rely on those food pantries because they slip through the cracks when it comes to qualifying for programs like SNAP. So at this point, I think Ms. Ross, I think you were here, and then we'll go to Mr. Raskin. Ms. Ross.
Well, thank you very much, Mr. Chairman, for holding this extremely important hearing. All of the hearings are important. North Carolina is a military state, and so whatever issues are affecting the military are amplified in our state. And I wanted to just share a little bit of information with you. Fort Bragg, which is in my home state, it's not in my district, but it's about an hour drive away, is the largest military base in the United States of America. It hosts nearly 600,000 active duty and reservist soldiers, 70,000 active duty family members, and over 120,000 Army retirees and family members. And it's currently facing a food insecurity crisis as many of its families struggle to put food on the table. The Fort Bragg YMCA started a food pantry last year to respond to growing food insecurity among military families. And in 2020 alone, the YMCA saw a 40% increase in requests for groceries. During the same period, America Serves, a network that helps military families, received the highest number of grocery requests in the organization's history. It's just simply unacceptable. A lot of it had to do with the coronavirus pandemic, but this is just systemic. It's been going on for years. And our servicemen and women and families make, tremendous sacrifices for the country. I'm the daughter of a veteran, and I've witnessed firsthand the sacrifices service members make every day. My dad was a psychiatrist in the Air Force during Vietnam, back before PTSD was even recognized. And some of the stories that he tells about the needs, mental health needs that he took care of and how that has evolved are really chilling. We can't allow these folks to go to bed hungry, and they deserve dignity, and we've heard about that today. I have a question just for all of the panelists. And what I wanted to know was how people of color in the military, we know actually there's a greater representation of people of color in the military than there is in the general population. And they suffer a higher food insecurity rate. And so what can we do to provide greater support in order to address racial and socioeconomic drivers of food insecurity and among military families of color? To anybody who has some insight.
Thank you so much, Congresswoman Ross. I appreciate the question. Blue Star Families is doing a significant amount of research on military families of color this year. In addition to our regular research, we're doing a special military families of color needs assessment this summer, and we're going to have a lot more data where we'll be able to ask people more probing questions. But here's some things we do know. We know that military families of color are telling us that they have less awareness of the resources and support that are available to them. In fact, it's one of their top needs is to be able to hear about these things. Why aren't military families of color hearing about resources and programs to the degree that white military families are? Well, social service research suggests that when the organizations are predominantly staffed and led by predominantly white staffs and boards, they tend to not reach these populations as much. And this is an issue Blue Star Families has identified. We're working on a fellowship program to provide a pipeline of military families of leadership of color to be leaders in nonprofits, but it's an opportunity for, I think, all of the service providers to look at this issue. Also, military families of color are more likely to be relying on their credit cards for financial problems, for financial stability when they run into concerns. And so I think there's more research we need to take on to understand why is it that these families are under greater financial distress in the first place.
Well, could some of it, as a follow-up, be just due to the racial wealth gap to begin with? So coming in without having that family support and that, just the extra money for an emergency.
I think that's exactly right. And again, we'll be able to get data about this. And if you have interest in this particular area, we'd love to speak to you separately about some of the questions we're asking and get some of your insights.
I would very much like to do that, and I'm working on several things to help veterans and active duty folks in North Carolina right now. And like Congressman Reichenthaler, I think this is a bipartisan issue, and would really love to do that. I'm going to ask one more question, and Mr. Chairman, I'm going to
before you do, I think this. Yeah, before you do, I think others wanted to respond to the question.
Okay, absolutely.
All right, so why don't we, Dr. Hefflin.
Thank you. I just want to take that issue in a slightly different direction and just say that we suffer from a lack of systematic information about the level of food insecurity among our active duty members. And this means that we can't identify and focus on the pockets of where it might be higher than others. We have, what we do have are member surveys or good surveys from specific military bases, we don't have systematic information. So if the DoD collected systematic information and made it available on food insecurity and food assistance participation, this would identify the problem. This would focus efforts, allow for innovation at the community level. It would allow leaders to think about who among their, what the local issues are among their active members that they're leading, right? Maybe potentially think about trainings to how do you lead a service members who are suffering from hunger, right? I think if we had good information, we would be able to track this, we would be more accountable, and we could shine a light on it. Right now, what we have is not very systematic data, we just need better data to really help us understand the problem and then hold ourselves accountable for fixing it.
Mr. Chairman, can I also add to that the idea that, you know, logically, anecdotally, we can put together pieces of information. We know that, especially during COVID-19, the ranks of essential workers are dominated not only by women, but women of color. That when we talk about military families, we understand that in order to be financially stable at all, you need two incomes for most of these families. And that therefore we can look at what are their spouses doing. And we already know, thanks to Blue Star Families, that a lot of these are, the spouses dominated by women is the spouse. Most service members are still male. And that the women in these households are in service positions. Many of them are women of color, and you can see that conflating. And then earlier when we had these conversations about the lack of childcare, for Mazon, another of our priority areas is about single mothers. And when we look at all of our populations, we speak of them in moments like this, in this more or less targeted way, but we see them much more holistically. We understand that there are a lot of seniors among veterans, and we care a lot about seniors. And we understand that there are going to be a lot of single mothers among those veterans. And the idea that we could also explore categorical eligibility around childcare for people who are getting SNAP or vice versa. There's not enough childcare, so qualifying for subsidized childcare is almost a terrible empty promise for a lot of families. But conflating all this information together drives us to know where we have to explore for greater data. So it gives us a systemic view, a holistic view, right? And that the racial injustice that permeates this country certainly permeates the military. And understanding in what ways it's actually impacting those families is what we look at researchers to do for us, so that you in these policymaker positions can in fact make change that is premised on real data for real solutions. And that's why you're in the positions you're in. You are vitally important in all of this discussion and this equation, and you have the power. And it's remarkable to see this focus on this issue, and now to understand how you're going to move it forward.
Mr. Chairman, I don't know if anybody else is looking to be recognized, and then I'll just ask my last question.
Okay, I don't see anybody else, so go ahead.
Okay, thank you, Mr. Chairman. And actually, that's a great segue into my last question, which is going to be a drumbeat that I plan to have on the issue of hunger. But a few weeks ago, the House passed the Paycheck Fairness Act, an important step forward in eliminating gender-based wage discrimination. And I spoke about the bill's capacity to cut poverty among women in half. And at the committee's last meeting on the hunger crisis, I asked a similar question to the panelists, but I'd like to hear your perspectives as well. And we just heard about women losing their jobs during the coronavirus pandemic and the need for childcare. But what impact would paying women equally for equal work have on food insecurity for active duty soldiers, military spouses, families, and children? We know that if the women are in the military, they get paid equal pay for equal work. But sometimes nobody's getting paid enough, and their spouses go to work and they're paid even less. And so any perspective on that would be helpful.
Okay, I'm just going to pick up where I stopped, because the chairman noted in my bio, I started and I ran the California Women's Law Center for 12 years before I came to Mazon. So you're just singing my song. This is the again, much as there is systemic racism in this country, there's also systemic sexism. Sometimes we would just call it misogyny flat out. But the issues that affect women who want to enter the paid workforce are different from those that affect men, because by and large, we haven't evolved to a place where there are shared responsibilities around children and households and the way we envision for a future, and that we want to embrace that as the positive. But in this context, what you see are, especially I think among active duty currently serving women in the military, they are experiencing challenges that many men do not. Certainly those about domestic violence and sexual assault. Again, looking holistically at them and their lives and thinking about what it means to be a single mother in the military, let alone a single mother as a veteran, and what impact that has on your ability to provide for your family. And I think that the fact that Blue Star Families would lift up the idea of childcare of one of its 3 supports for how to address this problem is incredibly important and speaks to a new way of looking at what we want to do for military families as well as for veterans. That is, that we want to think of them as people who are of both genders, and that those genders may have different needs. And there's nothing wrong with that. As long as we don't punish women for being different from men, there's nothing wrong with saying men and women are different. The problem is, I'm not quite sure we've hit that utopia. And so looking again to those of you who have the ability to break through those silos, Mr. Chairman, I love when you talked about the fact that what you can do as a part of the Rules Committee here is to really see things more holistically. And how delicious that is to think about the idea that you could formulate solutions that get at real issues, not just piecemeal them and have an unintended consequence that might exacerbate it somewhere down the road. I'm not quite sure if that answered your question, but I got excited, so I'm just going to yield back.
Yeah, well, you definitely answered a good part of the question, but if anybody wants to kind of pinpoint on the hunger issue, yes.
Mr. You have to unmute. Okay.
Yeah, thank you. I appreciate the lens on the gender issue, because I think it is interesting. Actually, when we look at male spouses, they are not as impacted by either unemployment or underemployment as female spouses are. And I think that's a very interesting finding. We do see that with the women who are working, the female spouses who are working, 3/4 are underemployed. So it really isn't equal pay for equal work. It's not, they're not working up to what their training and their previous work is. So I think there's opportunity there to create better financial stability from that lens as well.
Okay. Thank you, Mr. Chairman, and I yield back.
Yield. Oh, did someone else have I'm now yielding to Mr. Raskin.
Thank you, Mr. Chairman, for putting together this great discussion. And I've been thinking about an analogy with school lunches, which is something that I've looked at and in other parts of the world. And when a school lunch is something everybody eats together, then there's no stigma attached to getting, a special meal because you don't have the 25 cents or whatever it is to bring in to pay for a meal. And so by, in essence, making it a common good, then you destroy the whole stigma process. The military is very familiar with that because when you're in the military, all of your meals are taken together and everybody eats the same food and complains about the same food and sits together and so on. It seems to me that the veterans could help us deal with this problem of stigma in terms of thinking of food as a common good in the country. Of course, a lot of the programs that we're talking about are programs where people get individually compensated or what have you. But what I have in mind is, at least coming out of COVID-19, that there could be lots of meals or celebrations of people coming back together to celebrate the ability for people to be together, and to have the food be a common thing, and then to at least be able to pose in that setting the question of whether or not people are food insecure and whether or not, it can be addressed. But it seems to me that the stigma problem, as I talk to veterans in my district, is really a very big problem. And people don't want to feel like they're getting some kind of special handout, or that they have somehow let their families down by not being able to, to provide for them in that way. But you don't feel that where food is just treated as something that everybody gets together. So I'm just wondering whether somehow that can be built into the solutions addressing the problem. And I don't know if any of you have any thoughts on that.
I'd like to speak to that real quick, just from the perspective of some of the programming. And, there's like Chairman McGovern spoke to, there's many pieces of this puzzle. But on the emergency food end, one of the things that we felt value and got great feedback is not making it about income guidelines, just making it about being a veteran. And that's the piece of the puzzle. And that reduces a lot of that stigma, because they're proud of this, proud of being a veteran, rightfully so. But reducing those barriers, reducing those steps has been a big piece of it, because all they have to do is be a veteran or be an active military family. The rest is taken care of. And, we talk about that with other federal commodity programs, such as USDA TFAP programs, the CSFP programs, where there's income guidelines and there's means tests and all these paperworks that we have to go through. But, to eliminate that, and we've found that with COVID, and that's the silver lining that I think that food banks have found with COVID is, once we start relieving some of these barriers, we can feed everybody through, all the different food opportunities across the country, from the Emergency Food Network to the federally subsidized programs. There is plenty of food in the United States. We can do this. We just have to cut through all of those barriers and, get the food to people where they're at. And those are the things that, I know as a food bank, we've learned that. I know at the state level here at West Virginia, we have learned that, that getting through these barriers and just, making it about, like you said, making it about the food. That's what it's about. So I think there's great opportunities for us to do that, and lessons learned from COVID indicate that.
Jimmy, if you would say, Mr. Morrison, I got to know from my staff that you need to leave at 12:30. If you do, we understand, but if you don't, we'd love you to stay, or we can submit questions in writing. But I want to respect your schedule. So whatever you need to do, I
appreciate that. I can hang around for about another 5 or 10 minutes, but I do need to depart after that.
Okay.
So, thank you.
Sorry, Jamie, back to you.
I was going to jump in here around the stigma question, because I think that is a fundamental part of what we've been talking about today, is that there are tangible barriers to accessing adequate amounts of food for your family. And then there are these intangible ones. And because stigma is, I think, hard to get your arms around in a way that says, if you do X, you will relieve the stigma. People come to this with all kinds of their own internal challenges, right? And then there are externals that are putting greater stigma on them. And that's the piece that we can address and think about. One of the things that had been a problem, there was a program about a supplement to support military families around subsistence, and you had to go through base chain of command to get it. So it was almost never used. And the Military Family Basic Needs Allowance that is currently in the Military Hunger Prevention Act addressed that by saying you don't go through your chain of command to get this, that it's an open application process so that we don't add to stigma. I think the suggestions you've made about normalizing this, as if this is a part of what people need and that this is something that they've earned, are parts of what we would think of as a strategy here. But I think it's taken decades to impose a sense of stigma here. around those who struggle financially. And I don't know that there's a, I hate this metaphor, but I don't think there's a magic bullet to relieve it. All we can do is work on strategies that are universal enough that they are available to and accepted by everyone who needs them.
I just want to add here that a couple of suggestions that I mentioned before, I just want to underline again, are specifically motivated by this issue you raised, Congressman Raskin. This sense that if we offered transitional benefits to everyone at the point that they're transitioning from military to civilian life, and just made this thank you for your service. One of the extra benefits is that you get SNAP for 6 months or a year. I think that would increase take up later on. If we also created categorical eligibility that's connected to service-connected disability rating. And so it's now connected and not something that you have to necessarily go through a whole level of red tape. And so there are small fixes we can do that get at specifically this issue, because stigma is a problem for low-income households across America in terms of accessing their food needs, but it is especially difficult, especially large barrier for this population. And so there are specific fixes that we can identify to help improve the situation.
Great. Thank you, Mr. Chairman. I'm going to yield back to you.
Ms. Morris, there's a question for you. I know you have to leave, so let me get to you first if I could. In your written testimony, you described some of the challenges your food bank had with establishing a pantry at the VA hospital.
It says like there's no sound preferences at all. Oh, wait.